Okay, good morning. So I'm gonna perform an easy PAP. So first is we make sure we first check the patient's chart for any important information. Before going inside the patient's room, of course, wash or sanitize your hands. Introduce ourselves to the patient once inside and explain the therapy, such as good morning, my name is Anthony. The doctor ordered you, I'm from the respiratory care department, by the way. So the doctor ordered you a breathing treatment. This one is a positive airway pressure treatment called Easy PAP. This would help you mobilize and reduce any secretions and prevent your lungs from being collapsed. So first is we always make sure we check the patient's ID band for confirmatory purposes. After that, we also make sure we position the patient upright if they can and assist them if they could not. And we also have to do a set of vital signs and our pre-assessment. So after that, we wash our hands again, apply PP such as gloves, and we can proceed with the therapy. So when checking this, make sure there are no cracks on it. Make sure all the supplies are complete and no misconnections. So there are two ports. So this one is a pressure monitoring port. We're gonna insert it in here. Where also we can also initially start it up to make sure if how much pressure or volume the patient could reach. The other one is for the oxygen. Ideally, we start it up at 5 liters, not to exceed too much inspiratory flow, not more than 60 liters. We prevent that from doing so. And we hook it up with a flow meter. And then another thing is make sure all of these are secured connections. Position it like this. Make sure it should not be upside down. And make sure also we tell the patient not to the back. And then another thing is we should also have two options on it. Make sure there are also a mouthpiece where it is normally done with this device. At the same time, a mask in place just in case the patient could not tolerate the mouthpiece. For example, if I am the patient, make sure we always demonstrate in front of the patient. Teach them how to do it. Like first is put inside the mouth, let them take a slow deep inspiration and have a strong exhalation, not in a forceful way, as long as we reach it at 3 to 4 second exhalation time. So after that, let the patient rest for a few seconds. That way we could avoid any complications such as lightheadedness or any discomfort. And if the patient can cough, let them cough, assist them. Make sure we have a basin or even a specimen cup to make sure that we take note its color, consistency of its sputum. So ideally, this should be done not more than 5 times. And then another important information for this is it can also be done with a nebulization treatment where there's a T adapter in front, and it would help optimize and improve their lung function. And also this can be done also without a pressure monitoring port, as long as we close it up to prevent from exposure to ambient air. So once everything is done, it should be disposed. This should not be soaked up in water, allow it to air dry. Remove the tubing, put them in a safety container plastic bag. The mouthpiece, they can clean it up with a sterile water and allow it to air dry. Make sure we do another set of vital signs, post-assessment, auscultate it if there are any improvements of their lung sounds, reposition back the patient. Once outside, make sure we remove PPE, wash our hands, and chart everything what we observe to the patient and communicate with them.